Good day, everyone. I am Trisha Grace Lucas, and today I will be discussing about the mosaic Down syndrome. When a baby is born with Down syndrome, the healthcare provider takes a blood sample to do a chromosome study. Mosaic Down syndrome or mosaicism is a rare form of Down syndrome. Down syndrome is a genetic disorder that results in an extra copy of chromosome 21. People with mosaic Down syndrome have a mixture of cells. Some have two copies of chromosome 21 and some have three. In addition, mosaic Down syndrome occurs in about 2% of all Down syndrome cases. A baby would be said to have a mosaic Down syndrome if 5 of the 20 cells have the typical number of 46 chromosomes. The other 15 have a total of 47 chromosomes due to an extra chromosome 21. Mosaic Down syndrome happens when an extra copy of chromosome 21 is present in some but not all of the body cells. An extra copy of chromosome 21 causes the differences we see in people with Down syndrome. In addition, if 5 cells have 46 chromosomes and the 15 have 47 chromosomes, a baby has a positive mosaic Down syndrome. In this case, the baby would have a 75% level of mosaicism. Babies born with mosaic Down syndrome can have the same features and health problems as babies born with trisomy 21 or translocation Down syndrome. However, it is possible that these babies may have fewer characteristics of the syndrome than those with other types of Down syndrome. So, yung mga features ng merong mosaic Down syndrome ay meron silang small nose, mouth, and ears, slightly bent fifth finger, almond-shaped eyes with skin fold covering inner corner, white spots on colored part of eyes, flat, round face, and they are short and stocky build. So, irregular chromosome copies change the genetic makeup of a baby, ultimately affecting their mental and physical development. So, here are some symptoms of mosaic Down syndrome: slower speech, lower IQ, a flattened face, small ear, shorter height, eyes that tend to slant up, white spots on the iris of the eye. In addition, a Down syndrome is sometimes accompanied by a number of other health problems. This includes sleep apnea, ear infections, immune disorders, hearing loss, heart defects, visual impairments, and vitamin deficiencies. These symptoms are also common in people with mosaic Down syndrome. However, they may have less of these symptoms. For example, people with mosaic Down syndrome typically have a higher IQ than those with other forms of Down syndrome. For the diagnosis, doctors can perform tests to screen for Down syndrome during pregnancy. These tests show the likelihood that the fetus will have Down syndrome and can identify health problems early. The first one is the screening test. Screening tests for Down syndrome are offered as routine testing during pregnancy. They are usually provided during the first and second trimesters. These screens measure hormone levels in the blood to detect abnormalities and use an ultrasound to look irregular fluid build up in the baby's neck. Screening tests only provide the likelihood of a baby developing Down syndrome. It cannot diagnose Down syndrome. They can determine, though, whether more tests are needed to confirm the diagnosis. Let's now proceed with the diagnostic tests. It can confirm if your baby has a Down syndrome before it's born. The two most common diagnostic tests are the chorionic villus sampling and the amniocentesis. For the chorionic villus sampling, it uses a sample of the placenta to do this. This test can be completed in the first trimester, while on the other hand, the amniocentesis analyzes an amniotic fluid sample surrounding the growing fetus. This test is typically performed in the second trimester. So, yung una, during the first trimester, and yung pangalawa naman, during the second trimester. So, yeah, that's it for my presentation. Thank you for listening and stay safe, everyone.